Good evening. Thank you so much for watching HealthLine here on PBS Fort Wayne. I'm Mark Evans, your host. Very important topic tonight, and we're going to invite your calls on it. A lot of sports going on. A lot of injuries can be happening, especially with concussions. So we're going to be talking about those tonight with Dr. Kyle Littell, and he is a physical medicine and rehabilitation brain injury medicine physician. Nice to have you. I think you're well qualified for this subject tonight.
Well, thank you. I'm glad to be here.
And first time on the show.
Yes.
All right, well, very good. We're glad to have you. And Doctor, what we do is we invite people to give us calls to ask questions, whether it's for themselves or a loved one or a friend. Telephone number is, of course, on the screen right there. It's 866-969-2720. Please call at any time during the show. It is a half-hour show. We don't stop down for commercials because we are public television and very proud of that. All right, well, Doctor, let's just go ahead and build the platform for the show. What is a concussion?
Great. Yeah, I think
that's a great question.
It's a great question. Let's start on what are we talking about tonight?
Right.
There's lots of definitions out there, and so it's kind of hard to pick one all the time. But recently, the American Congress of Rehab Medicine came out with a definition of concussion, and I'm going to kind of summarize it because it's a multiple-page document. But really, you need a few things. One, you need a blow or a jolt to your head, something that kind of shakes your head, and then the other thing is that there's something after that blow. There could be some confusion, feeling dazed or confused is a common thing that people feel. Getting their bell rung is a common term that's used.
Boxing.
Yeah, boxing. And then also maybe you have memory loss. Maybe you can't remember what happened before the event or shortly after the event. It's hard to remember things. People sometimes repeat questions saying, like, what's today? And then 3 minutes later, what's today? They can't remember the information. And then also loss of consciousness. So technically you do not have to have loss of consciousness to have a concussion, which is a common misconception, but you don't want to have loss of consciousness beyond 30 minutes. So that's kind of the cutoff for that.
I think that'd be a long time.
It is a long time. However, if you go beyond 30 minutes, now you get into more moderate and severe categories of brain injury, which is also something important to realize is that concussion is interchangeable in the medical world as a mild traumatic brain injury, which is where my specialty in brain injury medicine comes along, is that we study this very in depth.
Okay, so as you mentioned, you don't have to be knocked out to have a concussion, but sometimes from the shows I've done on this particular topic before, I've learned that sometimes you don't even know you have a concussion until maybe a day or two later. That's
very true. There's some people that maybe they were in a car accident and maybe a few days after that event or even the next day, they wake up and they have these really bad symptoms like a headache or vision changes, and there's a variety of other ones that can come about, but it is something that you may not be aware of it, and it's important to realize what those symptoms are and then seek the treatment that you need.
In your particular practice, when it comes to adults, we'll talk about children here in just a second, but why are these adults getting concussions?
Yeah, there's many different reasons as to why people get concussions. Mostly what I see is people, unfortunately, that are in motor vehicle crashes, so car accidents being a huge portion of where concussions happen. I've seen a number of police officers. They're in their cars almost all day, and unfortunately, since that's their job, they end up having accidents that happen. And also falls, especially in the elderly population that maybe have a little bit balance issues or diabetes where they can't feel their feet as well, and then they end up tripping or falling. So some basic things like that, but anything can cause it. I mean, you could trip and fall, you could bang your head, a box could fall on your head. There's a number of things also like sports that are, definitely bigger in the media and social media about concussion and preventing concussion. So we definitely know that sports is a thing that we want to consider. And I think two other important things that I always like to mention as sources of concussion is our military veterans. They also suffer concussion from blast injuries. They're over in the Middle East, and unfortunately there's these explosions that happen, and maybe they're far enough away from the explosion that they're protected, but they also get that hit or that shock wave. And the VA has done an excellent job of studying concussions over the last several years. And then the other group of people is actually people that suffer from domestic violence. And I always like to let people know that if you're seeing somebody that is struggling and you're wondering, you complain of a lot of different symptoms, and just being cognizant to ask those questions. And even in healthcare, I encourage my colleagues to ask those questions. Do you feel safe at home? Is there anything I can do to help you as you learn those kind of things?
And is it the same for children, or do they have a different set of circumstances, especially when they're young, to get concussions?
Great question. So children, I would say, obviously are a lot more active than us adults. A lot of them don't have sedentary jobs, even though they're at school, but they have recess, they have PE, especially intramural sports and professional or semi-professional sports, depending on the age. So sports is a big part of concussion in the youth, and unfortunately as well, abuse is a part of concussion, and especially the little guys. And so we do want to be cognizant of when somebody comes in, especially if they're not able to walk or they're not actively, the scenario doesn't mesh with what the story says, then we want to be really cognizant about, is there some form of abuse going on as well?
Well, I'm glad you brought those up, and especially about the veterans. Honestly, I didn't think about that, but I'm so glad you did. So let's talk about, you get a concussion. So if you don't get it treated, what can happen with long-term effects of a concussion?
Yeah.
And we'll talk about treatment here in a minute.
Right. Yeah, I think the big thing about this is knowing the signs and symptoms of a concussion, because those are kind of the long-term effects. It's not like something where, you have high blood pressure and then the number's high. And that's what we're treating. Concussion comes along with a variety of symptoms, and those could be from headaches and dizziness, balance issues, nausea, sensitivity to light even can be something that people just complain of. Or maybe it's something as simple as like I'm more irritable. Some people say I have a shorter fuse, like maybe I could deal with some nagging that I could before, but now I can't. Or even being more sensitive to alcohol is something that can happen after concussion. And a common thing, though, is that, like we talked about earlier, that you may not be aware of it. Some people actually maybe have an injury and then they go back to work or to school, and they find themselves not being able to concentrate on maybe their math homework, or they're not able to sit at the computer as long because the screens are really in their face and it's bothering them. So really being cognizant about those kind of return to work, return to activity, or even play. Sometimes people don't know they have a concussion and go back to their sport the next day, and then they realize, man, just running down on the sidelines makes my head hurt. So being really aware of those scenarios too.
Okay, we do have a call coming in, and it's from Josh, who prefers to be off the air, which is fine, but we're going to read his question. Why are helmets designed to shatter?
Oh, yeah, that's a really interesting question.
It really
is. There's actually a variety of different helmets out there, and shattering is actually, so a good example would be a bike helmet. So bike helmets are made of a material that when they get hit, they do destroy in a way, and they're actually one-time use. So if you end up hitting your head on a bike helmet, and the reason is because it wants to take the blunt of the injury, or the force that's coming towards your head. And so when it breaks up like that, it helps to spread the force out more, rather than like some helmets that are very hard actually just transmit the force through that. So this is actually, it kind of is like a cushion in protecting your head.
Yeah, and I've seen those. In fact, I have a bicycle helmet. Luckily, I haven't had to, I use it, but I haven't had to use it. You know what I mean?
Yep.
But it has the foam insulation inside, and I can tell, well, if I did hit my head really hard, it would probably shatter or at least break. Well, I guess that's not such a bad thing as you just mentioned.
Nope. Yeah, it's a one-time use in the sense of if you fall and it breaks or cracks, it's time to get a new helmet.
Okay, that's a good word of warning there. Thank you. All right, and Josh, thank you for that phone call. The number on the screen is 866-969-2720. And just as I say that, another call is coming in from Bart. Bart, what is your question for Dr. Littell?
Yeah, my name is Bart. I was just wondering, my grandpa growing up, he said that boxing wasn't really good for those guys out there. They're just slamming each other's heads around and beating them up and stuff. And a prime example, not making fun of him, but look how Muhammad Ali at the end of his career, he could like barely talk and stuff. And then another thing, you brought something up about helmets. And is it really safe for those football players to be out there crashing each other like that? I'm gonna turn my mute back up so I can hear you, but thanks, doctor.
Okay, thank you for calling, Bart.
Yeah, thank you, Bart. So first, the question of boxing and concussions.
Yeah.
That is a sport that, as a brain injury medicine doctor, I wouldn't necessarily recommend, but I'm not going to say that it's a bad sport.
Mm-hmm.
I think that, just like any other sport, there's rules in this game, and we have to be very cognizant of those rules. But yeah, I think we do need to be careful and watch, those athletes. Those are some very elite athletes, and they go through rigorous training, and they learn how to also protect themselves. So they're not only just getting hit, but they're learning how to protect themselves. And I would say that we do want to have a medical team, and they have athletic trainers that are closely monitoring them. And there are protocols in place, especially for boxing athletes. And you mentioned like football. Is another thing. I would say that, is it safe for them to be out there? Again, we're learning a lot more about repeated concussion as time goes on. But at the same time, football players and the leagues that they're in are really learning how to protect their athletes more and more every day. Mm-hmm. And I think that's been one of the neat things in our research is we're learning more about concussion and brain injury, is that a lot of these leagues are actually the center of our research, and they're funding a lot of things to protect people. So I think that we do have to be careful in boxing or football or soccer or any sport, but we also want to lean towards safety for all of our athletes.
Absolutely, and Bart was mentioning about boxers, and just a quick little story about my grandfather, my mom's father. He was a carnival boxer back in the early 1900s, and he would travel with a carnival, and if you could beat, his nickname was Slim. He was 6'6", and if you could beat Slim, you won the prize. Well, Slim won a lot, but unfortunately, Granddad Slim was, as they would call, a little punch drunk in his later years. So being hit in the head that often, and what is the medical term for being punch drunk? What is
punch
that?
Drunk, yeah, so there's a term, CTE, or chronic traumatic encephalopathy. And so we are learning a lot about this. This has been something in the media and social media over the last several years. And it is something that we do want to be very careful about. The positive thing is it's very rare, and we don't really understand the full mechanism as to how it happens. But we do know that it can be from either multiple concussions, or it could be from even subconcussive blows. So just being hit in the head over and over. Example would be like a soccer player who heads the ball over and over. And so having those injuries continue on for many, many times can lead to something called chronic traumatic encephalopathy, which is basically a form of dementia.
Yeah, yeah. He had trouble sometimes with memory and also keeping his balance.
Yes.
And he was a towering man, but so you have to excuse me. Your granddad's a little punch drunk. So it's like you don't drink, Granddad.
Right. The positive thing I always like to say about that, though, is that it hasn't been associated with one or two concussions. So some people that have had a concussion, they ask me, like, well, am I going to get this disorder, or am I going to get dementia? The answer that we know so far is no, or very unlikely. It's been shown to be with people that have had repeated injury after injury after injury.
Okay, well, that explains that, I'm sure. Another call just came in. In fact, Margaret is asking to stay off the air, but her question is it safe to wear a helmet for seizure, or can that lead to concussions? Do you understand that question?
I think there are some people that have seizures and they wear helmets to try to protect themselves.
Okay.
And I think that's what she's asking there. I would say if somebody does have a seizure disorder, I think it would be okay to wear a helmet for protection, because some people that have uncontrolled epilepsy or frequent seizures can have these kind of drop attacks where they may be walking and then fall suddenly to the ground. And so having a helmet to protect them, I think, would be reasonable. But the thing also is that helmets help decrease the risk of concussion in a way, but they're not perfect. So even if you're wearing a helmet, you can still unfortunately get a concussion.
Yeah, it's not 100% fail-safe. I mean,
no, it's not.
You're going to have some problems, especially in the higher impact type of things. We'll talk more about some of the signs and so forth a little later in the show. You've already gone over that a little bit. But how, if you think you've got a concussion, or for instance, somebody gets hurt on the playing field, well, take them into the ER perhaps, or maybe a couple days later take them into the family physician. How are concussions diagnosed?
Yeah, I think that's a great question. So the majority of the time, concussions are diagnosis is made clinically. So we talk to them about their symptoms, the timing of the injury to their symptoms. There's a lot of people that think, well, if I have a concussion, I need to get an MRI or a CT scan of my head, some type of advanced imaging. We don't really have the capability of doing that at most centers. There's a few like research centers that have been shown that there's certain types of really advanced imaging that can suggest that you may have had a concussion, but the vast majority of our diagnosis is clinical. We're saying, did you get hit in the head, or did you have some jolt to your head, like maybe a whiplash injury that maybe didn't actually hit your head, but you shook your head violently? And then, did you have any of these symptoms after that injury, like we talked about earlier, the headache and the nausea and the vision changes and things?
Yeah, and I happened to come across something earlier when I was doing a little research for the show. It's the Glasgow Coma Scale. Are you familiar with that? Can you explain that?
Yeah, so the Glasgow Coma Scale is a scale that we use, especially in trauma, and when patients come into the hospital, we'll utilize this scale, and it looks at a variety of things. So it looks at your cognitive ability, it looks at your motor function, how you can move, it looks at your eyes, so there's a variety of components to that scale. And it's on a 15-point scale, and so if you have anywhere from 13, 14, or 15, so that's the higher end of the scale where you want to be, if you're in that higher range, then you will most likely have a concussion. If you're in that lower range, so 12 or below, then you're going to have a change in classification of your head injury. So it could be that mild or moderate severe brain injury, like maybe you're familiar with like a person who's in a vegetative state that has a really severe brain injury.
Yeah.
And so those numbers tend to drop lower and lower.
Okay. So the lower the number, the worse it is.
Yeah.
Okay. All right. Call just came in from Baz. Baz, thank you for the question. He or she is asking, if you get a concussion, can you suffer from short or long-term memory loss?
Yes, that's a great question. Thank you for asking that. The short or long-term memory loss, so the answer is, can you? Yes, you can. Unfortunately, most people that have had a concussion will not remember the event, and it may be sometimes fortunately. Some people that are in a car accident, it's fairly traumatic, and maybe you hit your head and you don't remember, driving the car, and you actually forget that event, or even you don't remember things a few minutes after the event. So sometimes I talk to patients and that have had a concussion in a car accident, and they say, well, I remember leaving work, and then the next thing I knew, the ambulance was there at the scene of the accident, and that whole gap is gone. It doesn't come back. Long-term memory, I would say, is less common. So it's not like in the movies where you get this amnesia that you can't remember anything from 20 years ago.
Yeah.
But you can struggle with memory. So a common thing that I hear as well is that maybe your wife told you to take the trash out, and then normally you would remember every single time, and then now after the concussion you're having a harder time remembering things like that, or maybe it's just some of those memories kind of drift away, like you can't remember somebody's name or somebody's birthday like you used to. It's a little bit harder to grasp those things, but it's not like you're forgetting your entire past.
Yeah, and that you're giving me memories about my granddad Slim. How about that? Some of those symptoms. Okay, another call just came in. Looks like Lynn asking a question offline. I was hit in the head by a soccer ball and saw stars. That happened to me once. Was that a concussion?
I think it's hard to say. You probably needed some more information and probably some further assessments to say yes or no, depending on how long those stars lasted.
Yeah.
Some people, if you just get hit briefly, you do kind of see a little jolt of light, just because actually when your head gets struck, your eyes also shake, and that can change some of your visual input just briefly. But if that kind of starry feeling in your eyes takes a while to go away, like several minutes or even hours, then yeah, I think a concussion would be reasonable as a diagnosis.
Okay. Also, we were talking about some of these old myths. I mean, certainly if somebody got hit in the head and lost their memory, you don't want to go back and hit them in the head again to reset things. I mean,
no, that does not work. Please do not do that.
How many times have you seen that on cartoons?
Yes, that's the wrong thing to do.
Definitely do not do that at home, that's for sure. You touched on this earlier, but I want to delve into this a little deeper. What are the potential risks or long-term complications of a concussion?
Yeah, so a few of the risks that we really want to be cognizant about are things like, unfortunately, brain bleeds. So whenever you hit your head, luckily, concussion, most of the time, your symptoms go away within just a few hours or even days. But we do want to be aware of what's going on. And so when you have a head injury, you want to be monitored closely, like you can have a brain bleed, which would be like subdural hematomas or things that people have heard about in the news from different even actors and actresses that have had these incidents that have happened. So that's why, like, if you're older than 65, or if you've lost consciousness, or if you have any neurologic change, like if you feel like you're weak on one side, you have new numbness or tingling, you've lost vision or hard to speak, anything like that, I would say go to the emergency room right away.
Okay.
And get that evaluated. Because that automatically bumps you from a concussion to that more moderate category of head injury. And so you want to be cognizant about that. We talked about the punch drunk syndrome.
Yes. Yeah.
And then the other thing is prolonged symptoms, or there's post-concussive syndrome. People give it different names. But basically it's when those symptoms last longer than you would expect. And so most people have their symptoms, again, gone within just a few days. Like over probably 85-90% of people, within just a few hours to days, their symptoms are gone. But if it continues to linger, then that's usually when you need to seek some additional treatment and look into, is there other things that we could be doing to help you in your recovery?
Okay, and hinging on that, what are the effects of repeated concussions?
Mm-hmm. So,
as for instance, an athlete, football player, get knocked out every other game or so. Mm-hmm.
Yeah, so typically we obviously want to try to prevent that.
Yes, absolutely.
Yeah, repeated concussions it's kind of hard to tell exactly what the repercussions of that is. Just like we mentioned the boxers earlier, like part of their job is to get concussed.
Yeah.
I mean, if you get knocked out, it's TKO, then that's what you're supposed to do.
Yeah, somebody wins a prize.
Yeah, that's right. But really, sometimes I have noted that if you've had multiple concussions, sometimes those symptoms tend to linger longer. So maybe the first concussion, it lasted for an hour and you felt fine after that and you could get back to whatever you were doing. And then maybe the second time around, it may last a little bit longer. It's not consistent though. Some people have multiple concussions and they have no problems. And even I've had patients that have had a repeat concussion, a few months later, and their symptoms actually recovered faster than their first one.
Oh, wow.
So it's very variable for these repeat concussions. But we do want to be aware of people that are having these repeat concussions as to, is there something going on? And that's one thing that we've also seen in our sports concussions, is that sometimes your balance can be affected. And for us that are just walking around most of our day, it's not that big of a deal because we're just walking. Mm-hmm. But however, in somebody that's an elite athlete where you have to cut and you have to zig and zag very quickly, then having just a slight difference in your balance can make a big difference in your athleticism, which then puts you at risk for higher concussion. So some of the tests that like the athletes and their athletic trainers are put through help us to determine, are you fully recovered? And that's when we really want them to get back to sport, is when they're fully recovered. We don't want to get them back too soon.
Okay. And we've got a couple more minutes left, and I've got a couple more questions for you. But, the kids, when they're out there on the fields and then they're playing and so forth, they really don't know what to look for or, what to report to the coach or their parents. What do the coaches and parents need to be watching for from the sidelines?
Yeah, I think, whatever sport there is, I think, one is just, watching the play happen and seeing, was that a hard hit? I think most of us, I enjoy watching football, and sometimes when somebody gets hit, I'm like, everybody kind of cringes. Like, when that happens. And I think in those moments, hopefully the parents and the coaches will kind of take a step back themselves. If they kind of cringe at the hit, pull the kid to the side for the next play. Say, hey, how you doing? Did you feel that? What are you feeling? What are you experiencing? And nowadays, there's a lot of protocols in place for athletes to say, okay, if you even looked like you got hit in a way of a concussion, we're going to take you to the sideline. We're going to take you to the locker room. Yeah. We're going to do a more in-depth examination. But I think just really not pushing them too fast to get back on the field. Whatever sport it is, right. I think that we do want to be careful about that. There is a disorder, you mentioned the kind of repeat concussions. that it's called second impact syndrome, which we do want to be very aware of, but it's also incredibly rare. There's only been a handful of cases reported in literature in the last several decades. But the biggest concern is that this second impact syndrome is when you've gone back to your activity and you have a second concussion before you fully recovered from the first concussion. And it can cause severe cerebral edema or brain swelling. And even sometimes it unfortunately leads to death. And so luckily it is very rare, but it's something that we want to be very cognizant about in sports.
Okay. Well, what a fascinating conversation, and very, we got to be mindful of those concussions, adults and children as well.
Yes.
Dr. Kyle Littell, thank you so much, a physical medicine, rehabilitation, and brain injury medicine physician. That's a long title.
Yeah,
but well-deserved, I'm sure. Well, thank you so much for watching. We'll see you next Tuesday night for HealthLine here on PBS Fort Wayne. Until then, good night and good health.
The preceding program on PBS Fort Wayne was made possible in part by...
It's a new day at Parkview. Another day to rise up and make life better for those around us. Whether that means pushing the boundaries of what's been possible, taking big strides, or sitting with a patient long after a shift has ended. At Parkview, we don't just do what's expected. We do what's best for you and your family. And we're determined to do it even better tomorrow. Every person, every day. That's the kind of healthcare we believe in. Parkview Health. We believe in better.